how can Europe harness artificial intelligence to improve healthcare, strengthen competitiveness, and maintain patient trust? To guide us through this debate, please welcome Mr. Roberto Zuffada, Executive Research Officer at the University of Milan, our moderator, and also the panelists Anca Scortariu, Luis Seco, Antoine Larpin, and Rob Smits. Roberto, as an extensive, please welcome. Let's give them a nice warm, go ahead. Sit down, please. Buenos días. Hola. Bienvenidos. Let me take this. Can I change?
Do you have to?
Yes, I have to. Yes. Okay, thank you so much. So thank you, Roberto. You have an extensive experience in coordinating European innovation projects in health, focusing how academic research can bridge the gap between science, technology, and clinical practice. So I think we'll have an amazing session. Thank you so much, Roberto.
Thank you, Fernanda, our Master of Ceremony. Hola, buenos días, bienvenidas y bienvenidos. Now we start the plenary session, the first one, and I'm very pleased to introduce our distinguished guest, the speaker of this session. First of all, I would start with the representative of the European Commission, Anca Scortariu, Deputy Head of Unit for AI in Health and Life Science at the European AI Office at the European Commission. Anca leads the European Commission's work on the ethical and trustworthy use of artificial intelligence in healthcare, helping to translate EU AI Act principles into practical frameworks for research and deployment in the health sector. Professor Luis Seco, Chair, Center for Sustainable Development Fields Institute, Toronto and Shanghai FEISHU. Luis has strong background in data modeling and risk analytics, brings an international perspective on AI for predictive modeling, decision support, and resilience in healthcare systems, drawing from his work at the intersection of mathematics, policy, and innovation. Antoine Larpin, Vice President for Government Affairs and Policy Europe and Kindrel. Antoine is a key voice in AI governance and digital policy advocacy, advising on how regulation and innovation can coexist to accelerate Europe's digital transformation in data and cloud. And finally, for industry, Rob Smits, Director, Public-Private Partnership at the Medical Office at Philips. Robert has over 2 decades of experience leading collaborative innovation programs between industry, hospitals, and research institutions, with a focus on how AI and connected technologies can make healthcare more efficient, personalized, and sustainable. So once again, thank you for accepting this invitation. And also, I would like to thank the organizer for inviting me to moderate this first session, which is devoted to AI. AI has been mentioned several times during the introduction of these 2 days, so we can go further and step in finally. In fact, we will look how artificial intelligence can truly deliver value for Europe's healthcare system, not only as technology, but as driver of innovation, efficiency, and competitiveness. As already someone told this morning, the question is no longer if AI will transform healthcare, but how we can scale it safely across member states. Together with our outstanding panel, we will explore this journey from policy to real-world practice, and discuss what Europe needs to move from pilots to system-wide operation. The program foresees a first round of questions and answers, and then we will start the discussion, and finally we will be able also to pick up some questions from the audience. So, if you don't mind, I will start with the first round of the questions, starting from the representative of the European Commission, Anca. I would like to ask you, Anca, from the European Commission perspective, what must Europe do to thrive in the AI era and support deployment for AI in healthcare? Anca, please.
Thank you, Roberto. So, the European Commission has the ambition to make Europe the AI continent, the place in the world to develop trustworthy, advanced AI models and solutions. And how are we going to support innovators and industry in achieving that? We are working on 5 pillars. Providing access to computing powers. Marco has already mentioned the AI factories. There are 19 AI factories currently deployed across the EU. These facilitate access for researchers and innovators, SMEs and other companies to advanced computing power from European supercomputers. And they provide additional support services around this computing power to optimize algorithms, data, and so on. Out of these 19 AI factories, 15 focus on health and life sciences. That is very significant. It shows how important healthcare is and the potential that AI has in healthcare. The second pillar is data. We can't have powerful AI without good quality data. You know, rubbish in, rubbish out. So it's very important that we facilitate access to data cross borders, and that's where the European health data space comes in, as Marco has already pointed out. But we've also invested quite heavily into developing advanced data infrastructures in cancer imaging, in genomics, in intensive care units, and also in supporting virtual human twins. So all of these to facilitate access to high-quality data for AI development in healthcare. The third pillar is talent. So we can't have advanced AI without having the necessary talent, engineers and scientists and researchers that push the boundaries on this technology, but also uptake and understanding of the technology in key sectors like healthcare. So we need AI literacy among healthcare providers. And the last 2 pillars are a supportive regulatory framework that addresses concerns, that builds trust, that supports innovation. And here the AI Act needs to work together with all the other healthcare-specific regulation, the medical devices regulation, the in vitro devices regulation, and so on. Marco has already mentioned that. But this is key to facilitate innovation in healthcare in AI. And finally, we have actions to support deployment, support the adoption of solutions in healthcare. And here we've recently published the Apply AI strategy that includes healthcare as one of the key sectors addressed. There are several flagships that maybe I will have a chance to speak about later, and support activities precisely to do that. So that's kind of the Commission's vision.
It's a very important point that you made, Anca, because it's the real starting point for following up the discussion. You mentioned the pillars of the strategy of the European Union, and now we can go through the other guests, entering into specific fields. So I will address the second question to Luis. Professor Seco, drawing from your experience in artificial intelligence and mathematical modeling, how can data-driven tools be better integrated into healthcare decision-making while maintaining transparency and trust among clinicians and patients?
Artificial intelligence is the use of data for everyday tasks. There's no AI without data, as you said. That has 2 very important implications. One is the organization of the data so that it becomes useful. I feel I'm the outlier here because I am based in North America and in China. I still spend about 1/3 of my time in Europe. And it's very interesting for me to compare how what I just said is viewed in America, in Europe, and in Asia, so in China in particular. So in China, it's all about innovation at all costs. In North America, it's all about profitability at all costs. And Europe is somewhere in the middle, but I still see that a lot of the focus on data in Europe is about regulation. It's very important to maintain the right balance between that and the pillars that you mentioned. To manage that is the big challenge. However, I think that the biggest impact is something that you also mentioned, which is education. But not education as we typically talk about education. I am at a university, and typically education is this thing that young people do. The big challenge for AI is not there. It's education for people in the middle of their careers. I have a prediction. Half of the jobs that you do here will not exist in 5 years. That poses a tremendous challenge for any system, in particular the healthcare system. When it comes to healthcare specifically, the ability of healthcare professionals to understand what data is, to be aware of what artificial intelligence can do and how it works. Oftentimes, AI is viewed as magic. It's not. It's the transformation of data into things that you do. So the awareness of the healthcare professionals about that is key. I just ran into the president of PSN, who's somewhere in the audience. PSN is the mutual insurance of the healthcare professionals of Spain. And they have taken the very interesting initiative to bring AI and education inside and to their pensioners, who are the healthcare professionals of Spain. This is a very good example of what I think needs to be done, and it's done right here in Madrid. And given that we are here, I thought it would be a good example to mention. So I endorse fully what you said, but maybe I give you this international perspective, which is how I think about things.
Thank you, Luis. Very interesting what you said, because you compared also the EU level with the US and China level. So the dimension of artificial intelligence, once again, is not silos, but we have to consider all the perspective, even a geographical point of view. I will give the floor now to Antoine Larpin, asking him, from an industry and policy interface standpoint, what are the main barriers that companies face when scaling AI solutions in Europe's healthcare system, and how can regulation and innovation be made to work together instead of intention? Please.
Thank you, Roberto. And big thank you to the organizers of this conference for having me, for having Kindred. It's a real pleasure to be here. I will start maybe just 2 words about Kindred, just to set the scene, explain who we are. We are a 4-year-old company leading in IT infrastructure services. We're the largest provider of digital infrastructure services in the world. We operate in about 60 countries. And what is at the heart of what we do is complex IT systems, mission-critical systems that cannot fail. So we run, transform digital infrastructure for banks, for airports, but also for healthcare organizations, hospitals, for instance. Again, systems that cannot fail. And I just maybe just come back to many discussions of this morning around the challenges of transformation for the healthcare sector. I was struck by, I think, the alignment of the vision that there are really huge challenges around the fact that we are facing an aging population, that chronic disease are increasing, and that is a very profound set of challenges that the industry is facing. And this is where we see a need for transformation, obviously, but also this is where we see AI at the heart of the opportunity for this transformation. So a lot of the challenges we heard about today, to me, seem to have an element of an AI answer when you think about, early disease detection, improving clinical decision-making, fight against health crises, research on genomics. I can keep going. But very much also at the heart of hyper-personalized medicines, you find AI solutions again. So I think that's really what is the opportunity to address this transformation challenge. And on the very positive side as well, we find healthcare sector has been rather conservative in spending in IT until the COVID crisis. But now, past this stage, we see predictions for a 15% growth every year between this year and 2032. So that's phenomenal investment that is going on in AI in particular in this space. Now, you asked me about the barriers, and I brought you some fresh data, and I love data. I hope you do too. We've just surveyed 3,700 business leaders, either CEOs, CIOs, or CTOs, about their digital infrastructure and their readiness to tackle the next big challenges, including how to deploy AI at scale, to your question, Roberto. We've surveyed these leaders in over 21 countries, 9 of them in the EU, including Spain. And what we found in terms of barriers is that there is a lack of readiness of these IT systems to tackle the opportunities or the challenges that these organizations are facing. And I'll zoom in on 4 big challenges, actually, very relevant to the healthcare sector. First of all is the state of the IT systems of healthcare organizations. 58%, here comes the data, 58% of organizations struggle to keep with the pace of innovation. That's in healthcare. We find that there is a planned investment, or actually over the last year, there's been an investment already enacted of 33% in AI, an increase of investment of 33% in AI. However, 3 in 5 leaders report that they feel more pressure to demonstrate a return on this investment already in the next 12 months. So investment is growing very fast in this space, but the pressure is also drastically increasing as well. That's the first point. There is an element of cyber readiness as well, cybersecurity readiness, which we haven't talked about too much this morning, I found. Maybe we'll come back to that. But think about cybersecurity as a foundation for a successful IT infrastructure in this space. And in particular, as I think the room knows very well, given the sensitivity of the healthcare sector, you must have it right, build cybersecurity in your systems. And cyber resilience. It's not only the security. We know many organizations have been already subject to disruptive attacks in the last years. Actually, I think more than 95% in the last 2 years have been facing disruption. But it's also about recovery. So the resilience is fundamentally important as well. The third readiness challenge is the skills readiness, with 87% of leaders believing that in the next 12 months, AI will fundamentally change roles and responsibilities into their organizations. Yet, only 50% of these leaders think that their workforce is ready. And the last challenge is regulation. And it's not only the complexity, it's not only the pace of change of regulation, but it's actually this perhaps I would say, need and call for simplification and harmonization. As among these leaders surveyed, actually 1/3 stated that regulatory or compliance concerns are the first barrier limiting their ability to scale AI investments. So that's a real challenge. And I pulled out from this data actually Spain as a market and Germany were the countries where this was really topping the list. There are some variations in other countries in Europe as to the main challenges to scale AI investment again, but very close to this also regulatory and compliance challenge. You will find the need to align business goals with their IT systems and aligning their population, the staff of each organization. So again, not surprisingly, but regulation complexity is a key challenge. I'll stop here, and I'm sure we can come back to some of these elements later.
For sure, Antoine. Thank you, because you entered into the point and you mentioned a lot of data. This is important to reasoning with this perspective. So thank you for providing us with this important information. And probably this information will be confirmed in some way, or giving the floor to the next speaker, Rob. Rob, you have worked closely with hospitals and health providers on introducing AI-based solution. So, which have been the key enablers and obstacle in translating pilots into daily clinical workflow, and which lesson can Europe draw for this experience? Please.
Thank you. Thanks for the question. First of all, I also want to introduce Philips, because people still see Philips on the TV screens, which is rightfully so, but we don't produce them anymore. In recent years, Philips has turned into a health tech company, so we manufacture medical equipment, scanners, hospital patient monitors. So hospitals are our key customers. So indeed, the challenges we have is to digitize healthcare and to digitize the hospitals with solutions that we can provide. And so the question, what is needed and what are key enablers to successfully introduce AI in healthcare? Let me work with an example then. We produce MR equipment, MR machines for magnetic resonance imaging, big installations that go into hospitals. And if you ever have been in one, it's noisy, it's loud, it takes a lot of time to make the image of the soft tissue, and you have to keep your breath for a long time and time again, to not have the motion of your breathing when they take the image. So around 6-7 years ago, Philips entered a challenge. It was called a Facebook challenge, to come up with ways to improve and to speed up MR imaging by doing motion compensation with what we called clinical decision support at the time, basically artificial intelligence. So that was 6-7 years ago, and the challenge was to compensate for the breathing. So you wouldn't have to hold your breath while you're in an MR machine. You can breathe. You can just breathe, so it would speed up the processing time of doing an MR image. We won that challenge. That was great. Together with Leiden Medical Center in the Netherlands, they provided the data sets and the patients. And it enabled us to show that the speed could be improved with 3 times. So from nearly 10 minutes to back to 3-4 minutes to do the scan. Plus, we automated the workflow around it. You could prepare based on the features of the patient, of the body features, how the machine should be installed, so you could further decrease the scanning time with around 10-15 minutes, reducing it from 25 minutes to less than 10 minutes. And you can imagine that that's a big, significant improvement to be made for a hospital, because in the end, one of my key points is it should make sense for the customers. If you want to include AI in solutions, it should really assess and address a clinical need. And here it's a workflow need. You can speed up so much time, so you can do more patient scannings in a day. And that was the main driver for doing this. You prove the concept back in, let's say, 2019, but still it came to the market 1 year ago, 2 years ago. It's now called Smart Speed. It's part of our solutions in every MR, nearly every MR solution. And in between 2019 and 2025, there was a COVID crisis which set us back, but there's also the claims validations that you have to do. You have to prove it over and over again, that it works with different Tesla strengths, that it works in different settings, and you have to get your certification done. So that is the things that need to be done, and that take a number of years before you can really come to a certified, FDA-approved MDR-compliant solution. So the enablers is time. It all needs time. Regulation, knowing that the regulation is clear and interpretable, and that you can get your proof points. Those are main enablers to come to the market And the main and most important enabler is showing the added value for the customer, for the hospitals, for the doctors, but also, and maybe most importantly, for the nurses and the radiologists, the people that do the processing, the people that suffer from burnout because the pressure is so large on them. So AI can really help, would be my final statement, in alleviating that pressure, that burden, to come to faster and more patient-driven solutions. And yeah, that's where we want to focus. Thank you.
Thank you, Rob. Thank you for giving us some concrete examples of enablers for AI, time, regulation, value for customers. It's very important. So based on what our speakers said, I would like to start the second round of questions. Maybe we can share answers. The first one is about mechanisms and forms of collaboration between industry, academia, and public authorities, or funding models, which can really help moving behind isolated pilot projects to AI adoption and deployment. I would like to start with Anca. Please.
Thank you. So our studies have shown that whenever we have successful pilots that have deployed AI solutions in hospitals and shown results and were integrated into the workflows and all of that, these were often because there was some champion in this hospital, in this healthcare provider, that really lobbied for this solution and persuaded colleagues and persuaded the IT department and persuaded the hospital manager and all that, and got the solution deployed, and then it showed the results. And it's what Rob was touching on earlier, showing value added. So what we're trying to create now as part of the Apply AI strategy that I mentioned earlier, one of the flagships is establishing a network of advanced screening centers. And we're focusing on using AI for the prevention, early detection, and diagnosis in cancer and cardiovascular disease to begin with, because these are two important disease areas that have a very heavy burden on society, on healthcare systems. And the idea here is that we create a community of practice where hospitals that have the capability and the interest in deploying AI solutions join this network, they work on the deployment, and they exchange best practices with other hospitals who then can share in their knowledge or who can learn from what they have done and absorb this into their own projects. Now, this flagship is going to work hand in hand with a network of expertise in AI deployment. This is a group of experts that are clinicians, managers, IT developers, ethicists, and so on, that are going to take all of the evidence that is generated from this network and from various projects that the union is funding, and create guidelines, create deployment playbooks, work closely with national regulators to support them with evidence in developing national strategies, with the aim of precisely expanding the adoption of these solutions and their deployment at scale in national healthcare systems. Now, of course, you all know probably that healthcare is a national competence, so the Commission, what we can do is support member states and build these ecosystems and bring together the different players from healthcare, from industry, policymakers, and so on, to create this evidence, to show the added value of these solutions, and to support in sharing the experience and creating these guidelines. So these are kind of some priorities we're focusing on right now.
Thank you, Anca. Thank you, Anca, for this perspective. I will give the floor to Rob on the same question. So again, mechanism, collaboration, or funding model. Please, Rob.
Yeah, thanks. My office is within Philips responsible for our engagement with public-private entities and public-private partnerships. Philips has chosen the approach for decades to use open innovation to advance our innovations, to do it together with universities, research centers, and hospitals. So these programs like you're addressing are very important, the Digital Europe program, Horizon Europe. I specifically wanted to point on one joint undertaking, the IHI, which I think is a great example of getting one step further. IHI is the Innovative Health Initiative. It's the joint undertaking between pharma industry, medical technology industry, and the European Commission to come to innovation in the healthcare area. And I think the good part of it is that it's co-funded by government, by the European Commission and industry. And for Philips, it's an important means of setting the agenda together with the European Commission, and identifying topics that are relevant also for industry to come to solutions where we see the need that we hear with hospitals. And they are 4 to 5 years, the projects. They're quite significant in partnerships and in amounts of funds. And it's just that one program that gets us one step further than, may I call it, the average €5 million project that Horizon Europe is funding in the regular calls. Because you not only create your solutions, but you also create the collaboration between pharma and medical technology, between research centers. Let me give an example. The Imagio project was funded like 3 years ago, so it's now about halfway. A project on interventional oncology where we try to test and validate in clinical studies different interventional oncology solutions. So not needing surgery, but using minimal invasive solutions, either guided by MR or guided by interventional X-ray, and to bring those solutions into clinical not into clinical practice, to test them in a clinical setting, in a trial. So in 5 years from now, we have gathered enough evidence to make the next steps. And yes, then it's still 3 to 4 years before it can come into clinical practice. But I think the size, the duration, and the level of cooperation between industry and academia is very important means to make that step. So I think that's a good example, but many of the other programs that are starting now have similar opportunities. Only getting from the end of the project to real implementation, that's the big challenge. And we try to make that in IHI by having sufficient industry involved.
Thank you, Rob. Once again, it's clear which is the role and the ambition of the European Union in funding mechanism, how it is important to have a program set up as Horizon, the former generation and the current generation of Horizon, how is important for the private sector and also for the private and public sector to come together and build upon this mechanism. The last intervention, Antoine, do you want to add something on this point?
Yes, maybe I will bring one concrete proposal in addition to what we've heard from other panelists, which were really great points. Anca, I like how you described the computing capabilities that is being built in Europe and the factories with a focus on healthcare AI development. What we anticipate, and not us, but our customers, our partners, is this booming demand for more compute power with the competition from other sectors. I mean, we know it very well. Energy access is being booked out for the next 3, 4, 5 years now. So access to a source of energy, building the computing, the data centers, is just happening now with high competition pressure points. We believe that to connect what we were addressing earlier, the need to scale the enormous amount of data that is required to be processed, images, other type of data, we really need to make sure that this infrastructure is aligned with the challenge and the opportunity. So the proposal is really to make sure we scale up. And ahead of us is this initiative led by the European Commission called the AI gigafactories. So to take existing factories really to the next level not in 2 years, not in 3 years, but already from 2027. And that's a great opportunity actually to think about developing this capability in Europe with a strong focus on healthcare, and actually also the opportunity is to build also with what has been done already, is not to redo it, but create a federated environment, infrastructure, to tap into all this data, all these computing powers that are already being deployed in the countries. And Spain is a great place. It's very well placed for this, actually. The commitments, access to energy, data centers being built, that can be leveraged for these purposes. So I think that's really something I would encourage everyone to look into, with this opportunity to build AI gigafactories with a focus on healthcare.
Thank you for sharing this concrete proposal. I guess that Luis would like to add something.
Yes, let me give you a North American perspective on what I heard. When it comes to funding, I agree with everything you said. But let me talk about private funding. I think, and I'm not trying to tell anybody what to do, but my observation is that it's the process of creating startups, innovation in Europe is too complicated. I think that needs to be made easier. And I don't know what it will take, but I think the financial sector needs to increase their risk appetite. I find private venture capital funds, private equity investments to be too conservative in Europe. And this is very important so that these commercialization efforts take flight and change the world.
Thank you, thank you. Anybody would like to add something? Antoine?
Maybe just to build on what Luis said, because that's very, very interesting. I think a data point was this calls for interest that has just run at EU level about these gigafactory projects. Several respondents to these calls for interest have indicated that actually they already have gathered enough private equity, venture capitalist money, budget that does not require extra public funding on top of it. But they really welcome this extra stamp from the European Commission being recognized as one of the leading projects. And this is more about trust than it's about actually funding money. Very interesting development.
Yeah. Maybe on that I can add some figures. For these gigafactories, the Commission has put 20 billion on the table with the idea of co-funding 5, and we got 77 proposals from across Europe for the establishment of these gigafactories, more than 200 billion on the table from the member states and from private funding. So yes, there is huge interest in this.
So you talk in the first round, even in the second, about the importance on healthcare professionals. So I would like to address now another question about this level. How can we prepare healthcare professionals to work with AI tools without overburdening their workflows and creating resistance to adoption? And I would like to start with Luis from the academic point of view.
Yeah, this is one of my favorite topics.
Yeah.
Education of healthcare professionals. It all starts there, and it's incredibly challenging because AI is not something that most healthcare professionals were born with. It's very recent. And they typically don't come from the part of knowledge that gave rise to AI. So I would start with awareness. Awareness is very important to understand what all this means. What does data mean? Do people understand what data means? For most healthcare professionals, the concept of data is what you've traditionally called data, which is your clinical analysis and this and that. Metadata is where the real secret is. Your real-time location, what your watch is recording, all of that, and how that can be used and is used by some of these devices and some of these methods and some of the, it's critical, and so that's the you know, at the low level, the concept of awareness and knowing what that is, and then of course to learn all of the innovation that's taking place as it happens. That's so challenging, and this is where the collaboration between the private and the public and the private sector could really shine. And of course, universities should do their role, but sorry, they typically don't. Very saddened for me. I happen to work in one. Okay. if we could create that social network of education where companies take charge, where universities take charge, where governments take charge, and the healthcare system take charge, so that people, I'm talking to people in their 40s, in their 50s, learn what's happening as it happens. I think that'll be great. But that is hard. That requires a concerted effort of all participants, all social actors, and that's, I think, the big to-do.
Thank you, Luis. Anca, you mentioned before the talent and the importance of education. So which is your thinking about the healthcare professional?
Well, education and all of the initiatives we have in supporting training programs and all of that is important. But I would also like to point out that, in my view, what's important is to integrate these AI solutions into the workflow in a way that is seamless, in a way that healthcare professionals don't actually need to put in extra effort to learn how to use them. They should be intuitive, they should be already a part of the system. And in fact, this is what we're focusing on now with the initiative I mentioned earlier, with the advanced screening centers and these pilot projects, a number of other projects that the Commission is funding. We're looking at supporting innovators in developing solutions that can easily integrate into clinical workflows, that can work with a variety of systems. The European health data space, for example, is supporting harmonization in the exchange of data between electronic health records. We also want AI systems to be able to be integrated with a variety of systems in a way that is seamless. And for this, we have projects such as the cancer imaging data space, a federated infrastructure that makes available high-quality data sets from different hospitals. Each hospital keeps their data, so they're not put in a data lake. They're secure, and innovators have access to this data to test their solutions in a variety of hospitals to make sure that a system that has been developed with a certain data set and works brilliantly in one hospital also works very, very well when you start using a different data set produced with a different healthcare technology vendor, and you see different systems, so that when this solution is deployed in hospitals, it's integrated seamlessly, and healthcare professionals don't have to go through the trouble of each time learning how to understand and how to use a different system. That's important. And then, of course, education and all of the measures we talked about earlier, the idea that healthcare providers need to understand concepts like what is data. This reminds me of 15 years ago, I went into a hospital in Romania where I was working in the private sector, and we were deploying a hospital management system there, and I went in to help train staff and to talk with them about the challenges they're facing in deploying the system and so on. And I realized that with the nurses there, I had to start by teaching them how to use a mouse and how the cursor moves on the screen and all that. So, okay, when that was 15 years ago.
It's a good story. It's a great story.
I hope things have evolved.
It's a real life story. No?
But yes, this is it. I was going there, to show them how wonderful our solution was and how easy it was.
Start from the basic elements.
So now, when we talk about AI, I can only imagine what a nurse that is used to working with a certain system, and I know that in some parts of the EU, they still use pen and paper. So, the challenge is significant. But okay, little steps. Yeah.
Step by step. Yeah. Antoine, step by step, or what?
I think maybe what I would add, I like the points made earlier, but maybe what I would add is the cultural dimension, actually, to build trust from the workforce. And I would say, if I were to be provocative, I would say actually this is maybe not specific to healthcare sector. That's something we see that workforce needs to be, to be embracing AI as opposed to be feeling it's an hostile technology, and so there is a cultural shift that is needed. For healthcare, what I think is more specific is people want a human-centered healthcare. That's the human should remain at the center of many of the relationships. And yes, this relationship can be enhanced, supported with AI. Agentic AI as well is something we are looking into. Actually, we're working with the University of Liverpool on a pilot actually to assist on the social care aspect of healthcare treatments. So it's work in progress, public-private partnership to the earlier question. But I think this cultural shift can also happen by also working with the healthcare professionals early in the implementation phase of a project, ensuring there are strong AI ethical guidelines and rules put in place. I think that's the key ingredient as well. And ensure transparency around the goals and implementation of AI solutions. That's to me, to us, that would be the secret ingredients on how you build trust from the workforce.
Thank you, Antoine. Rob, do you want to?
Yeah, two things that come to mind that are worth sharing. The one is also with our medical equipment, we find out that 70% of the features are not used in hospitals. So it relates to Anca's story. You have so many things that you develop that could be great if only people would use it. Now, where AI could come into play is by replacing that manual button that needs to be pushed manually by doing it automatically. So there's an opportunity to get more out of the systems without people having to do it, if you can automate it. That's one thing I wanted to comment. And the other was related to Louise's comment. I very much recognize that within Philips, we're all pushed to use AI in our daily operations. So people middle-aged like myself, what are you using it for? We work with Word document, we work with text, so then you enter with LLMs. What can you do with ChatGPT, Copilot? Try it, apply it, see how you can use it, because you can talk to the hospitals, and the same goes for my colleagues that do imaging, use AI for what you do at your daily job. You can only explain it as a company if you apply it as a company. I think that's one of the major steps to be taken.
Thank you. I have a last question for all of you. It's about data again, which is a cornerstone of our discussion. So how can we ensure that data access, relevance, and quality could engage innovation and competitiveness in AI? Rob, I will start with you.
Yeah, this is where the story might get less positive from my part. We already heard say rubbish in is rubbish out. But at least you need to get data in. And gigafactories are great if the data is available and can be put in. But we found out, and it must be known to many of you, that it's hard to get access to data for secondary use. So hospitals are very restrictive, understandably very restrictive of sharing data of their patients, which needs consent and needs their approval. So getting access to data is really hard for research organizations to do further research, for companies even more, because it might be commercialized and people rightfully have a fear for that. But it's needed to, let's take the IHI example, the Imagio example, it's needed to have access to different data sets that can be combined and can be put together to do further research, not just with one university hospital, but with a multitude, or with non-academic hospitals that have many more patients. So there's very good initiatives that we're also participating in, but there's a lot to be done. I think Marco and also Anca mentioned the UK project for cancer image sharing that Hospital La Fay is coordinating, where we have a small role in that as an industry partner, developing AI tools and then be able to test and validate that on the data set, the collective data set that will be made available through such a project, which is a stepping stone to the EHDS. We're also partnering in the Indicate project, which does the same for ICU data. But already in these projects, we start noticing that organizations choose for federated learning. So data stay with the hospitals, you collect it centrally through a federation, but you don't get access to the initial data. So if we're developing AI tools, we need to be able to prove it, to get it certified, prove it in a second step and in a third step with the original data sets that we've worked with. And if these projects do not choose a solution that works, allows access to the original data sets, we will not be able to develop any AI tool on it eventually and get it certified. And I think then you come into the heart of the issue from as far as I can see it, and I'm not really into the topic in depth, but that's what I hear back. If we keep choosing for federated learning in Europe, we will never be able to validate and deploy the AI tools based on that. So we will still need to go with 1 or 2 hospitals, buy data sets, work with that we can guarantee that we have access to whenever we need to prove it. So data spaces are really important. The projects are good, and people really work hard to get to that next step of reaching the European health data space. But there needs to be more centralized and centrally available to be able to prove what is being developed upon that data set. So the input can be very good, but if it's not enough and we cannot have access to it, it's still rubbish.
Luis.
It's so important that data is... I have a proposal. I thought we're in this conference. Spain has been for a long time a leader in organ donors. I would like to encourage Spain to become a leader in data donors. Why not? And let me explain to you what I mean by that. And by that, I'll say one example. One of my collaborators is a Spanish psychiatrist. His name is Enrique Vaca. You may know him, world-renowned. He's done something very interesting. He studies suicide. And he had some patients who I gave him data, which is not just the traditional clinical data, is their real-time location, Google takeout, is massive databases. And he's able to create a very good understanding of how that happens, and maybe that could open up the road to prevention, which is the key to health, right? So maybe I leave with that, a very practical proposal, because data is important. Without data, there's nothing. AI is not magic. It's the clever use of data that you have. You don't have data, you don't have anything.
So we have 5 minutes left. So I will give the floor to Anca for concluding the session, and then, if possible, one question from the audience. Anca, please.
Concluding the session
On the data.
Okay. Maybe I will just add one element that hasn't been mentioned yet. As part of the data union strategy, one of the flagships is establishing data labs within the AI factories. And the good news is that there is a health data lab project under development. It's led by Sweden with collaboration from other member states, with the idea of collecting, of course, health data and making it available along with computational power for those developers that are interested in testing, validating their solutions, and so on. And speaking about testing and validation, the Commission is also funding a testing and experimentation facility in healthcare. Again, an AI testing and experimentation facility, again, for developers to be able to test their solutions in real-world settings. And this is a consortium made up of different hospitals that have prepared really high-quality data sets that can be used for the testing of these solutions. And these can include algorithms and AI models, but also AI-enabled surgical robots, or really quite advanced solutions. So, and also just to address what Rob said earlier about the concerns linked to federated data sets. And I believe that there will be a solution found for the those companies that use these federated European infrastructures that are available across borders to demonstrate that they have used, representative data and high quality data simply by showing that they have used these infrastructures, so that they wouldn't have to actually present the data that they've used to train their solutions, but indicate, what data sets that they've used. That's a bit the idea behind, the certification process. So let's not be too concerned about this development of, these federated data infrastructures. I think they are going to be really a great solution in the future, meeting the concerns about privacy and security of data with making this data available to companies.
Thank you. Thank you, all the speakers. Now, I would like to have the opportunity to one question, maybe two. The first one is the gentleman with the white shirt. And the second one, Leo Lewis. Sorry, but we have 3 minutes left. So, very short question, very short answer.
Hello? Sorry. Try to be quick. So my name is Antonio Lines. I'm a clinical psychiatrist. I've actually worked under Dr. Baca Garcia, Enrique Baca, so I've been working in digital psychiatry for a while now. Just a quick observation on the federated data sets. I'm not sure the problem is the publishing of the data, but the overfitting of the model to a specific data set that then cannot be translated to other hospitals. And so I don't think that would be solvable even if we didn't publish the outcomes. But the general question is how can we bring the private sector more into this, right? We, and in mental health, we're basically choosing treatment based on trial and error. We have a very significant number of hospitals with very good quality data sets where we could try treatment, where we could train treatment prediction algorithms. Hospitals don't have the capacity to do this. Universities don't have the capacity to move whatever they find to the market. So whatever is developed locally, some things that are developed locally end up staying locally because there's no go-to-market strategy, because the private sector is not there, really. And the solution would be for the private sector to be able to access hospitals' data in a secure and...
Yes. Thank you. Sorry, but we
I got
have
there.
to finish.
Thank you so much.
Luis.
So I disagree with the overfitting of the data. Don't worry about that. I'll take care of that. You give it to me. The rest is very important. I think you hit the nail on the head, that the private sector participation is a challenge and it has to be addressed.
The final question, Leo Lewis, please.
Yeah, thank you. I agree with all the comments that have been made, but I think there's an elephant in the room that we haven't spotted yet. I think the talking about the increase in productivity, that's great, except that it'll cost the system more money as we put more do more scans, etc., etc. So the elephant in the room is, how can we redesign using AI? How can we get better processes and workflow? And Louis, your point, and the gentleman here asking the question, the data sets, I love the term data donor, because all of this AI is being based on what's in our electronic records, and there's very little person-generated stuff coming in to influence the AI algorithms and get better treatments. So I'd be interested in your thoughts.
I have a very simple recipe how to address this. We need more events like this one.
Maybe, Rob, do you want to?
Yes, for the scans and the use of technology, of course, the more opportunity there is, the more possibilities, the more pressure will be put on. So I think with every solution that we bring to the market, it should also be supported by nurses. That's why I talked about nurses, radiologists, the staff, not just the doctors, to alleviate their work. The example I gave about the MR scan, if you speed up 3 times, you can put 3 times more people in the scan. Or you can choose to do 2 times as many people in the scan. that's a hospital choice to make. Do we fill it as much as we can to do as many scans as we can, or do we create a bit of room, a bit of space for the radiologists and for the nurses? It's that line of thinking that can help in addressing your issue.
Last word to Anca.
I just want to give another example. A study conducted in Sweden has shown that through the use of an AI tool for the triage of pulmonary embolisms, they managed to reduce the time to treat from more than 28 hours to less than 1 hour. Just imagine the difference that makes for somebody walking into a hospital expecting, to be diagnosed and treated, and instead of waiting 28 hours, you get your treatment in less than 1 hour. And this is enormous, and this is why these conversations need to continue. The investment in adoption of these solutions needs to continue.
20 seconds, Antoine.
I think that's the promise of the scale we're talking about. Scale is not about only about innovation, it's also about these productivity gains and cost reductions.
Okay, so I was supposed to make the wrap-up. I will not wrap up anything because the speakers have been excellent. Thank you to the audience for the attention, and I'm hearing the next session coming. So thank you again for your kindness, and have a good summit. Thank you.
Thank you so much to all panelists for this insightful discussion. Your reflections on interoperability, human-in-the-loop design, and scaling AI responsibly shows us how Europe can lead not only through technology, but through trust as well. So we now move to a session that connects technology with preparedness and resilience. The COVID-19 pandemic revealed how crucial data coordination is for health resilience. This plenary will explore how can we build federated, interoperable systems that allow Europe to anticipate crises and safeguard continuity of care. Please welcome our moderator, Ana Garcia Robles, Secretary General at the Big Data Value Association, and also the panelists, Manuel Brocos Iglesias, Lolo Rebolo Revezado, Elena Torrente, and Simón Estades. A big applause for all of them. Welcome, bienvenidos, welcome. Ana has over 2 decades of experience driving European data and AI innovation ecosystems, promoting collaboration between industry, academy, and the public sector. She has played a key role in shaping Europe's data-driven health and digital transformation strategies, ensuring that data serves both people and public value. Thank you, Ana, and welcome to the stage with all your guests. Thank you so much, Ana.
Thank you very much, and thank you for having me here. It's a pleasure to be with you all, and thank you to the Digital Europe team. And well, we are going to talk today about the strengthening health systems resilience, a multi-data approach, and I have a panel of fantastic speakers. So first thing, let's meet our panelists. I will start with Manuel Brocos Iglesias. He's head of section at the Spanish Ministry for Digital Transformation and Public Administration. I will say a few words about you, Manuel, if you don't mind. Yeah. So he works in the development of Spain's national health data space and focus mainly on functional design, coordination, and secure secondary use of health data. But he also represents Spain in the OECD Working Party, that is a working group, on data governance and privacy, contributing to international discussions on interoperability and responsible data reuse. And Manuel has also a background in technology, communication, and digital transformation, and he supports national and European health data initiatives. I'm going to ask you to clap a lot today, so you so clap for Manuel. Our second panelist is Lola. Lola Rebollo Revesado, and she is head of public sector at Cloudera, and she's an expert in data interoperability. So Lola, you have more than 20 years experience in the technology sector, and Lola has led large-scale data analytics and cloud transformation projects for public entities and healthcare organizations across Europe. So good experience for the panel. She advocates for open architecture and responsible data sharing models to make public services more agile and secure, bringing a wealth of knowledge on leveraging platforms for maximum public health. Big applause also for Lola. Now from Lola, we move to Elena. I have to say, with my big heart, that I welcome Elena. Elena and I, we worked together like 16, 17 years ago, and we haven't seen each other so much since then. And we were already working in open innovation and in digital health projects at that time. Well, Elena is Director of Strategic Development and Digital Health at DKV Salud y Bienestar. Elena is a leading expert in digital health and innovation with experience across Spain's public and private sector, including Aquas and the Catalan Health System Institute. At DKV Salud, she drives digital transformation and data-driven healthcare innovation. And also very important, Elena has been recognized by the WHO as a digital health expert, and she also serves on the board of the Spanish Digital Health Association. Big applause for Elena. And last but not least, Simone Stades, Regional Director at Orion Health. And Simone brings extensive experience in deploying digital health infrastructures across Europe and also the Middle East, connecting hospitals and administrations through interoperable platforms. And his work bridges innovation and practical implementation in the ground. You will see. Big applause for Simone. And I had prepared a very, very short introduction, but I have to say that by listening to the previous panel, and thank you to the panelists and the moderator, I'm going to change a bit this introduction before I give the floor to the speakers. And thank you because you really left, you paved the way to our panel. And very important, I think here today the majority of you are very much focused on health, on digital health. We are witnessing this digital transformation. We have witnessed during the whole day today at a regional, national, European, and even worldwide level. And we know this digital world generates a lot of data, also commented in the previous panel, a lot of volume, a lot of variety, and we are going to talk about that. But also, the previous panel was commenting, yeah, but data alone, we need to do something with that data. And it's true, I mean, on value and in particular resilience, we will focus a lot in resilience. In this panel, it's not only achieved by having data. It is achieved when diverse sources of data are connected, are governed, and they are used. And again, previous panel talked a lot about AI. And this is important that it's used timely. And again, as we talk about resilience, we have all the experience on the COVID, and I remember at that time, the first thing that were activated in my context was all about data sharing and how we can share the data to really generate more knowledge of what is happening and support. So that's what we are doing today, how a multi-data approach can strengthen Europe's ability to anticipate and respond to health challenges. Also, very important topic that I want to highlight, we are going to talk a lot about interoperability, but it's not only as a technical requirement, but as an ecosystem challenge. And that's very important when we talk about ecosystems. Just allow me for 1 minute to tell you why for me it's important to be in this panel. Also, I love the previous panel. Sorry, I mentioned a lot the previous panel. The association I work with, the Big Data Value Association, European Association, we work with data and artificial intelligence, is very much focused in this discussion and the discussion of the panel before. And it's actually one of our priorities to expand data-driven ecosystems across sectors, countries, value chains. And that's actually the focus of today. Also, I have to say, just a coincidence, we have a very active task force in healthcare that is actually led by Philips, by the team of Rob, who spoke before. And many of the topics of today are very, very connected. Also myself, I have the pleasure to contribute to the whole program of Common European Data Spaces. I'm part of what maybe some of you have heard, the Data Spaces Support Center. There are also other colleagues in the room with that role. And for this Data Spaces Support Center, exactly the discussion of this panel matters a lot. And finally, the discussion is very much focused on the recently published Data Union strategy that, although being a very horizontal strategy, also focused in the ability of having a lot of data available for reuse and actually also for AI. And now, this is the introduction of what you can expect. Now let's go to what our experts will tell us. Manuel, I will start with you. We'll ask you a question. So you work at national level, also international. So from a national perspective, how is Spain building the governance and interoperability frameworks that allow health data to be securely shared and reused across sectors while aligning with the European health data space?
Well, first of all, I would like to thank Digital Europe for having me here and also to present the work that is being done from the public sector. I would like to start by stating the obvious. Spain has a very decentralized healthcare system, and that presents many benefits, but it also presents many challenges in terms of data governance. We need to create a coherent framework without removing the autonomy from the regions. And we also have to ensure interoperability without centralizing data. And with that in mind, we are building the Spanish health data space, the National Health Data Space. We're calling it ENDS, which is the national system for the governance, for organizing and enabling the secondary use of data, the use of data for innovation, for research, and for public policy design. The ENDS is a decentralized platform in the sense that all the regions keep full control of the data. It provides a clear framework, a clear set of rules. It also provides governance, and it provides a technical infrastructure. The technical infrastructure is very important because the ENDS works connecting existing data sources and providing secure processing environments for the development of projects, or as we call them, use cases that have been approved under strict conditions and safeguards for data protection. And as for the governance model, the governance model is designed and organized, coordinated jointly by the Ministry of Health and the autonomous communities. The Ministry of Health provides leadership and chairs the inter-territorial committee. And there are also have been created a set of new entities, especially the Office of Health Data inside the Ministry of Health, which oversees all things related to data governance. And also there has been a set up committee for use cases, for the approval of use cases and evaluation of use cases, also with the participation of the Ministry of Health, the autonomous communities, and the Ministry of Digital Transformation. And there are also other committees related to data quality, also data protection, interoperability, and other subjects. And as for, well, and this is all anchored in the Spanish health strategy, digital health strategy, and also ultimately aligned with the European health data space. And as for funding, we have funding from the Next Generation EU funds. Precisely is 70 million euros for the creation of the European, for the Spanish national health data space. And we are also, apart from the health data from this ENDS, we have also set up in the cross-sectoral data spaces in, I think it's around 330, something like that, across different sectors. We have created an acceleration program, which out of these 330, 48 have been in the health sector. And lastly, we are providing also currently a set of grants for data holders to federate their data into these new data spaces that have been set up. And well, lastly, in conclusion, we're trying to turn a highly decentralized health system into coordinated data sharing ecosystem, and also fully aligned with the European health data space.
Well, thank you very much, and it's super interesting all these committees for governance that actually you are setting up. Maybe later we have the opportunity to see and discuss how this can be scaled actually at the European level. But let's move into another question for Lola, okay? Sure. Complementary one. And well, we know you are very keen on open source, data platforms, software in general. It was said in your introduction. How do you think that open source data platforms and software that is used for data spaces can help public administration and health system to manage multi-data environments? And multi-data is very important, right? Securely and efficiently while ensuring transparency and citizen trust. What can you tell us?
Okay, well, good morning, everybody. Thank you, Anna, and the organization for inviting me to be part of this panel. Without a doubt, we live in an environment that we've digitalized everything. We've digitalized public administrations, health systems. We wear devices that provide health data, health record, genomic data. We've built a mess. We've built all this data that is dispersed everywhere. And the core challenge here is managing this sensitive data securely and efficiently while maintaining the citizen trust as well. And open source is an answer that is the best way to go, or I think is the best way to go for healthcare systems, because they balance the security, the transparency, and they build trust. And let me tell you something. Let's ditch the idea that open source is cheap and is not secure. Open source is being supported by thousands, hundreds, and millions of IT developers in the open source communities, and they are security experts that actually are always watching to make sure the code is secure. So that is the vision of the many eyes looking at something. So once we've ditched the idea that open source is cheap and is not secure, we can get things implemented faster because we have, and not in our paychecks, we have all these hundreds of thousands of developers making sure that platforms are secure using open source as the building blocks of any platforms. Like I said before, multi-data environments are a real mess, okay? Mm-hmm. So we have to make sure that we use open source because it's built on open standards. So when we use open source open standards, all of a sudden all this multi-data starts to fall into the little buckets that as a unity will make a strong health data platform, breaking down the data silos and making sure we transition into something that can give those responses. And this is ideal because we have to give super fast responses in case of emergency crisis. And we saw that during the COVID-19. We saw how the systems were different. We could not talk to each other. We are on the right track to unify this data and to make sure that we can talk, systems can talk to each other, and also saving money and making it your own, okay? Forget about vendor lock-in fees. Extremely, and I'm sorry for the colleague from Kyndryl-IBM, because we think that if you can tailor the open source to suit what your region or your country needs, you're going to be faster and you're going to spend that penny where it makes the biggest difference, okay? And then the last is about public trust confidence. And let me tell you, this is something that we need to work on an individual basis and as countries, as regions, and as Europe. People don't know why their data is needed. We need to make a lot of educational efforts to tell people your data is data for good, is going to build better therapies, better treatments for your colleagues. It's going to be secure, and here is the rights you have. The data is being collected for secondary use, but you can opt out. And I think that once we're transparent with that statement, the people, and I look at Luis, yes, Spain is it's on the head for organ donors. Yes, we are probably going to be ahead for the data donors, but we need to train our citizens on why the data is crucial and how it's being collected. I work in the European Commission as an expert for the EIC accelerator and a scale-up, and in other countries, people are starting to opt out, and they're saying, do not move my health data into the cloud. I want to have this pen drive with my data. We cannot afford, as a continent, as Europe, as a one, to have that permeate to other member states, because at the end, we're not going to be behind, which is going to be absolutely obsolete from what our citizens and our healthcare system. So, like I said, open data platforms like Cloudera, which I'm glad that Miguel Lopez Valverde was here this morning. Cloudera is the platform that the Madrid healthcare system is operated on. Okay, they are top-notch. They're using a lot of AI use cases. The president of the Madrid region was recently in our headquarters in the United States, announcing this public sector and data project that is going to be using Cloudera to give better services to public users, built on Cloudera, which is an open source data platform. So don't forget, open means secure, fast implementation, and to have a huge squad of developers, not in your payroll, but working because they trust and they believe that open data is, open source is the way to go.
Very good, Lola, and very interesting that you are now talking about this educational aspect and how we really need to inform people, about why we need their data, or why our data is needed. I know this panel won't elaborate very much on the let's say, cybersecurity aspects, but it's true that even if we tell them, your data is secure with us in general, not talking about, we experience a lot of breaches of data day by day, and it's something that we also need to educate people on what that means and how to, be.
Yeah,
it's a different, wider topic, but very, very, very relevant. Well, we started with Manuel and the governance at the national level. Lola, as you notice, has been providing input more from the technology, interoperability, open source data platforms. Now we move into innovation. And Elena, that's your specialty, so I'm going to give you interesting question. From your perspective, in the private health sector in this case, how can data integration and digital innovation contribute to building more connected and resilient healthcare ecosystems that strengthen both preparedness and patient outcomes?
Thanks, Anna, for the question. First, I would like to thank to Digital Europe for inviting DKB to contribute to this meaningful event and for gathering us around a topic that I think is crucial for Europe's future, which is digital health. I think we would all agree that digital health is no longer something residual or secondary, but it is becoming the backbone of equitable, efficient, and sustainable healthcare in Europe. In Spain, as in many other European countries, private healthcare has a key role in delivering care to citizens. In Spain, private expenditure stands at 2.5% of the GDP, and 29.5% of the Spanish population has a private health insurance. This is around 14 million people that hold this double coverage since we do have a public healthcare, national healthcare system. And this private healthcare is provided by more than 400 private hospitals. And what we see from the private health sector's perspective is that both data integration but also digital innovation are essential for building resilient and patient-centered healthcare ecosystems. So first, for data integration, we see that there is fragmented data across hospitals, public and private, insurers, national health systems in Spain with the 17 different national health systems that we have. And we see a clear need to really work on interoperable platforms to improve patients' and clinicians' experience, but also, and of course, to gain on efficiency and to avoid duplication of medical tests, which is quite often. No? At DKB, we are working with this vision for a long time. We are a Spanish healthcare insurance company. We are part of Ergo Group, which is a German group that at the same time we are part of Munich Re, which is one of the major reinsurance companies in the world. And we've built an ecosystem with that vision of integration with third-party solutions, so to adopt digital innovation that give better outcomes and better outcomes for our clients. We do have integration with lab results, with online appointments. We do have a telemedicine platform, symptom checker. We offer several digital health tools to our customers, both from our own developments or partnering with third parties, specifically with startups. And this is, we think, key for delivering accessible access, so for bringing much access to our customers to healthcare, but also to work on digital prevention tools. There has been a very important step in the private health sector in Spain, which is led by the IDIS Foundation. IDIS Foundation is the entity that comprises all private, the main private companies, health companies in Spain. And IDIS Foundation has developed a new project in an interoperable platform for medical records, so that the patients from the private health system can share their medical records regardless of the medical center they are going to. This initiative is a major step for private healthcare in interoperability and in the creation of this single European health data space. It's compliant with the European Health Data Regulation, of course. And we think so the data integration, as I said, is essential on one hand, and on the other hand, as I said, also the digital innovation, which is can help to bring better health outcomes. And here we see so plenty of solutions and innovations that go from predictive analytics and all what AI can offer to transform raw data into actionable insights. Also, all what has to do with acute care, with telemedicine platforms and remote patient monitoring. And of course, at the end, all those digital tools that empower patients with personalized information, improving engagement, adherence, and long-term outcomes. So yes, so we think that if Europe can align both with integrated data and also digital innovation, this will not only respond more effectively to health crisis, but also create a more proactive and patient-centered system.
Yeah, very good, Elena, and it's great to see, when you say, yeah, data integration is needed, but you actually said, but it's fragmented, no? The data ecosystem at the moment is fragmented, so we will go now to see how we can help. What is your vision in how this should evolve? But it's still very positive to see that there are these projects like the one you mentioned that is already helping in creating this integration. Mm-hmm. And some of the examples that you provided actually are very connected to the comment of the previous panel on also the secondary use of health data. Mm-hmm. And I'm also, very much thinking that we need more and more to give more availability of health data for secondary use for innovation, which is your domain. And now, Simon, I think you also bring all this experience in deploying interoperable health data infrastructures, as we said, in Europe, but also in the Middle East. So what practical steps are most critical, you think, to ensure that multi-data systems, and here we go from hospitals to national platforms, everything, how can they be connected, scaled, and sustained in real-world environments?
Thank you, Anna. Thanks to the organizers for inviting me today at the panel. And I'm very proud to be sitting with these amazing professionals. And I think I'm here today because of the experience I'm bringing on the real-world implementations. Orion Health, we've been around for 30 years. We only do healthcare. And we started developing Rhapsody, which is one of the top interoperability platforms in healthcare. And from there, we moved into developing population health and preventing care platforms that we have implemented in more than 65 regional or national organizations around the globe. Basically, we are very strong in Canada, in the UK and Ireland, and in New Zealand and Australia, which is where we are from. So I'm just trying to bring some anecdotes of what I've seen implementing some of these big projects. Remember, these projects, depending on where in the world, they have different names. In North America and Middle East, they are called HIEs, Health Information Exchanges. In Europe, historically, they were called electronic health records, EHRs. In the UK and Ireland, they are called shared care records, SCRs. But at the end of the day, it's the same concept. It's platforms that integrate data from multiple different sites and try to do it in the best way possible. So first anecdote, I was 2 weeks ago on one of these health IT congresses in Spain, and there was a discussion about how are we progressing on the European health data space implementation. And one of the people talking, she explained that there was already, they have been working on building this data space for healthcare, and they opened it a couple of weeks ago for requests, and the very first day, there was already 19 requests received to access data. This is great, this is good, This is not a problem. The problem was more, okay, and now what do we do with this? Who's going to approve this request? Who's going to extract the data? Who's going to anonymize the data? Who's going to monitor the use that is being done on this data? Who pays for the human and computers power that is required to provide all these services? And I think here is where Manuel and his team adds the more value, defining all this governance model that needs to rule what is going to happen in the next few months or the next few years. Before you open access, you have to have a platform with data, and that's already a challenge by itself. Out there, it's an odyssey of all kinds of situations. The real world is not. There's plenty of legacy systems. There's plenty of unstructured data. The volume of unstructured data is incredibly high. The data that we have collected historically doesn't need to be at a decent quality for the kind of use that we wanna provide with these new infrastructures. And even if we have systems that are at the right level of data quality and expose those interfaces to exchange the data, they might be hesitant to exchange that data with us because there's no clarity on what's going to happen with that data, what is the legal situation on sharing that data with us. So I guess when we think about these kind of infrastructures at a regional level, exposing them at a national level and now in an European level, there's a lot of work that needs to be done around governance, around consents, around patient identities. It's not something that is going to be quick and easy. It needs to be done well and carefully. Another of those anecdotes, and it's been following me for years, when we implemented the HIE in Abu Dhabi called Malafi, the authorities wanted the highest extreme level of quality. That we had to go live in 6 months, and that put a lot of pressure on all the teams on the ground, not just us as the provider of the central platform, but also the hospitals, clinics, labs. They had to change all their systems to make sure that every single attribute that they were sharing was correct. All kind of boundaries were put in place to make sure that data had the right quality before it was accepted by the platform. And at that time, I was shocked. I thought, that this was a little bit too much. Looking back 5 years from that point in time, I can see that Malafi is one of the fastest growing organizations. They are ready for AI, they are ready for prediction, they have a clean, trusted data set of information, and every time they want to do something else, they don't have to reinvent the data. They already have the data. So that's one of the learnings that I took from that project, how important data quality is in this scenario. So for me, it's 3 foundations. 1 is governance with clear rules, who is doing what. 2, data quality, high levels of data quality, no optional. And 3, decisive leadership. What happened in Malafi showed me that sometimes you have to mandate. It's not just a voluntary kind of activity what we are doing. There's a mandate to do it, and if you don't do it, there's implications, because otherwise governance without leadership becomes only theory. So those are my 3 takeovers.
Well, that's very interesting, because it's true. I mean, governance, you are talking all the time, who does that, but at the end of the day needs to have a very clear mandate. 2 things that call my attention of your input. One of them, what you said, the first example, as soon as we open the data, we have these 19 requests. But then there are other environments where data is made available and there is no this, willingness to go and innovate with that data. So it's interesting that healthcare actually is a domain where there is a lot of appetite to innovate with the data. But second, the topic of data quality, really, really relevant. And very good learnings, that it's good to put foundations strong on data quality. And that's a very important part of resilience and, let's say, scaling and speed. Very, very good. So let's continue. I have to say, for sure you will have the time to ask and provide questions at the end, as it happened in the previous panel. But let's go with a bit more of the more dynamic round of questions. I will start, go back to the very beginning. So we heard a lot about national data governance, or a lot, or a bit on the, not a lot, but at least Manuel gave us good introduction. So what is the role, what role should national data governance authorities play in ensuring that multi-data systems remain interoperable across member states? That's the important part, and aligned with European frameworks. I will start with Manuel.
Well, if I'm allowed to get a bit philosophical, interoperability is the holy grail of the data sharing ecosystem. And if we look at the European approach, we see a clear top-down approach. Building the European Commission is pushing for these big data spaces, sectoral data spaces in energy, in healthcare, in manufacturing. And from the Spanish point of view, we are going for a more bottom-up approach. As I explained before, we have created this more than 300 multi-sectoral data spaces, and that are being also expanded with this new set of grants that we are provided for new data holders. And for the authorities, I think it's very important to promote innovation in interoperability, to set a clear set of guidelines, as Simon was pointing out. And for that, we have recently launched a new entity, to call it in some way, which is called the CRED. It's a CRED, is the Center for Reference for Data Spaces, which is in charge of harmonizing, giving guidance, and also monitoring the newly created data spaces. So I think that's also important for interoperability. And this is a bit of the initiative that we have active at the moment.
Yeah, and very good your comment about how to combine this top-down for Europe with this truth. And in Spain, the way it has been set up, it's a lot of smaller use cases. Yeah. And I hope we can really achieve that both things are connected, and the bottom up can connect with all these major big projects. Yes,
that's the challenge. To make it part of a wider European data space.
Indeed. And Lola, I see you are nodding. Maybe you have some input for this question as well.
I don't want to say the contrary to the public sector, but no, I think that no, we're friends. I think it's standards, and I think within the healthcare, we are ahead in terms of first, semantic standards like FHIR or SNOMED, ontology standards. OMOP has been adopted. But going back to this, bottom-up view, a lot of the data spaces that have been built are in verticals that don't have standards, and we don't know if in 2 years, transport is going to say, hey, the new standards are this. So for me, the role of the national entities is to be sort of like the referees. Okay, let's take it to the sports field. So they have to be the referees. They take the global rules of the sport, in this case the data spaces, and they translate it and they say, to little kids or to grown-ups, first division or whatever, these are the rules of the game. Okay, if you go by the rules, then we're fine. Okay, what we need is that everybody has the same rules. Therefore, we do need standards. The national entities are the goalkeepers in data spaces. They're the ones that are going to decide who enters the data space, especially in healthcare, and what are you going to do once you enter. So I think that they play a crucial role. They're incredible. If we want to be successful in this, And I would say, just very much like with medical devices, we have the CE markdown. I will ask Europe to consider classifying data platforms with that CE and not to allow any solution to go live that doesn't have the CE platform. And I look at the colleague from Philips. You know what I'm talking about. We can't afford, this little startup that comes up with this brilliant idea to use a different standard, because then we're going backwards. So Europe, Digital Europe, take it back to the Commission and say, can we create a CE markdown on technology and IT platforms as well?
Sure. Any reaction from any of the other panelists on this one? Okay.
I certainly agree. Yeah. It's just, it's important. We are playing with human lives here, but it is also a very complex process to follow the regulatory, to obtain CE marking is an expensive and long process, and not everything is a medical device. There's platforms that are just configurable, and it's difficult. Yeah.
Yeah, and Elena.
Yes, just I completely agree, of course, and I will also add that national authorities have here a clear role also as facilitators of collaboration between public and private institutions and private providers and regional health authorities.
Very good. And just to say, with the standards, it's very good. The whole part more horizontal of standards is being now standardized at the European level. So we hope that comes little by little to help us. Maybe standards are not sufficient. Something that caught my attention, you were talking about gatekeepers. We don't have time to elaborate a lot, but I know what you are talking about, but it's a bit of contradiction that when we are talking so much about the centralized systems, still we will have these gatekeepers that are the ones really governing the different ecosystems. Okay, more to discuss separately. Let me also, and I'm going to go back for a moment to Manuel, because I liked, what you were talking about, this top-down and bottom-up. And now I would like to know your opinion on what are the main barriers to really scale, these initiatives for federated and distributed data infrastructure across Europe. How do you see it now from your...
I think there are two main barriers, which are organizational, cultural, and technological. From a technological point of view, well, we need to ensure interoperability again, not just connecting via an API, just need a true semantic interoperability. And we also need to create secure processing environments for the sharing of data in a secure way. And this is a technological barrier because it's not an easy undertaking. And also organizational, well, Lola was mentioning it before, that we need to persuade people what's in it for the people, not to share the data. And also, not only people, I think also at all levels, administration as well, private sector. I think it's not clear, as the Finnish Prime Minister was saying, that there is a lack of this concept of what's in it for me by sharing my data. No? And also, I think this is a cultural barrier that that is being very difficult to overcome.
Yeah. Indeed, interesting, no? That when we talk about interoperability and all these frameworks, we know technical, then semantic, and you are highlighting a lot organizational interoperability, and then culture, and that's also, that we need this kind of culture interoperability, right? If we want to build this at the European level. And Simon, you have experience also on this topic. What can you tell me?
I have. When you are doing pilots, you are putting together a small team or parts of an organization that are voluntarily and willing to make things happen. So, the lack of specific aspects of governance, the lack of specific aspects of semantic interoperability, they just find workarounds, they go, they do it. When you want to scale up pilots, you need to have all this in place. You need to properly define your governance. You cannot just rely on local teams to bridge gaps when there's governance gaps. You cannot rely on local teams to do mappings when you want to scale something at a national level or an European level. So there's a lot of semantic, not just the standards, but also which semantics are we going to use to exchange this information. I think all that needs to be in place for being able to scale. And then the other thing is about trust and consent, I think, institutional trust. When you are exchanging data on a federated environment, you are not just exchanging data, you are depending on other organizations for obtaining the benefit that you are trying to look for. So I think it's important to also provide that trust, not just to the organizations, to the citizens, to share their data, who is going to use it, on what purpose they are going to use it. And if this is unclear, I would assume participation is going to slow down. There's going to be patients opting out. There's going to be organizations that are not going to put this project on their top priority. So I think those things are important. And then just finally, and it's also a proposal on the table, like the previous plenary here, if Europe wants to scale governance, coordination, operational control for 17 regions in Spain, for 27 countries in the European unit, and cross-industry, we need a lot more than that. We are talking about skills, about people, hands on the job. So my proposal here is why we don't develop a set of AI agents that are not there just for understanding data and finding trends, but to help operational teams on the ground with all the work that needs to happen. Ethical compliance, anonymization of data, navigating huge libraries of information, and govern semantic interoperability. All that, the technology is there, and I think if that's done at a European level, we are ensuring that there's trust, there's no more fragmentation and we provide this tool set or layer of AIs to help speeding up these, scaling up and speeding up all these pilots or projects.
Yeah, definitely super good proposal. Personally, I second that proposal because we are actually starting to pilot a lot of these activities in our community, and definitely we think it's also a way forward. So thank you for bringing this up. Any other reaction to what we just said? So I'm going to have a final round before opening for questions to the public. And because this was also a panel very connected to the topic of resilience and emergencies, and because all of you commented so much on the governance, let's go into that governance topic. And how do you think we can strike the right balance in between the centralized data control and coordinated European response during health emergencies? Who would like to reply? Lola, you see, you are looking at me. What is your...
No, because they're saying 5 minutes, and I don't know if you've seen it, so.
That's good. We will.
I think we've said it. Basically, I think we need to, the trick here is centralize the governance while keeping the data control and storage decentralized at local level, keeping the data sovereignty in the region where the data is generated and it's stored. I think that is the key for the GDPR, especially the health data. It's not easy, but I think we're on the right track. And if we do that, the response in case of a crisis or an emergency is going to be unified across all member states, because we would have that common rules, common standards across 27 member states, and each of the countries will hold their data, keeping that from being moved, which is something that with federated learning, you keep the data where it has to be. We don't move the data to the cloud to do analysis. We keep the data and let the tools come to the data. And I think that is something that we are misleading in when we make decisions, or when the public sector or private sector makes decisions about what platform. Don't let the data be moved from your infrastructure. Let the tools come to your data.
Well, I think we could have another panel just to discuss that, because I heard different opinions in the previous panel to this topic, and also, but very good. We are now open into the panelists' viewpoints. Anyone else to comment on this question, Manuel or?
I think in times of crisis is when the weaknesses of the system come out. No? And I wasn't working at the in the public administration back in when the COVID-19 pandemic hit. But discussing this question with my colleagues back at the office, they told me that at that time there were a lot of confusion about protocols for sharing data. I think it's just maybe an easy fix to create a clear set of protocols for sharing data, because I've been told that data was being shared in a very rudimentary way. So yeah, that's my my suggestion.
Very good. Thank you very much for that input as well. If there are no more comments here, are there any questions from the audience? There is one over there.
Hi, I'm I'm Eglis Gonzalez from the European Patient Advocacy Institute. It's a bit a comment and a question, and also related to the previous session. And you're talking a lot about the data sharing and how, whether patients also actually would like the data in the cloud or not, on different systems and so on. And I haven't heard mention the patients as the stakeholders here, as this collaboration. Have you worked on that? Have you worked with patient communities? I mean, at the end, yes, the healthcare providers are the users of these tools that are being generated, but the data is from the patients, and those are the ones given permission to be used as a primary or a secondary use. So what are your thoughts on that, and have you been working with the patient communities, and how do you see that? Because it's also a key part in this.
Indeed.
Yes.
Indeed, and thank you for bringing this patient-centric, human-centric question to the table. Who would like to answer?
I can comment. Without a doubt, the data belongs to the patient, and they have the rights to opt out. And our systems and our governance of the platforms need to cover that. There's no doubt about that. But if I'm not wrong, in Spain, by default, we all are opting, not just for making sure that you can receive the right healthcare in those cases where you might not be awake, but also because of public health. We need to have the data of everybody, unless you purposely decide not to. Yeah. I think that's what happens in Spain, yeah.
Mm. Yeah. Anyone else who wants to comment on the question?
I think, it's been said many times in the conference before the other speakers, but we don't need to lose sight to the fact that in the end, all this talk about governance, about systems, about data sharing, the ultimate goal is to provide better outcomes for patients, to build a more robust healthcare system. I mean, it may sound like hollow words, but it's the ultimate goal of all these.
It's more probably on engaging patients in the build-up of all this.
Yeah.
It's not asking the patient whether their data is on the
something
build-up,
yeah.
because the needs for healthcare providers are one thing, and the needs of the patients are different things. And the technology, so it's, I mean, you have it, and it was mentioned in, I think, by Rob, so European projects. European projects now, they have patient engagement groups. So you have patient view, you have the IT views, the research views, the healthcare providers, everyone gives their views and the needs. And that's what I mean mostly. Mm-hmm. It's the inclusion of the patient, expert patient that had a lot of knowledge on the the area and give input on what are the needs, so you cover everything. And it's also maybe what it was discussed, so there are tools, but they are not used, it's the same. So it's, try to build something that is being used by the healthcare providers and that is useful for the patient and accepted also, that they like that the healthcare providers are using whichever tools we are then developing for them.
I honestly think it's an excellent comment, but it's true that in many of those projects that are now implementing all this, there is definitely this patient engagement. At least in my experience in all these projects, I see always patient engagement, and it's more and more this user-centric living lab approach is more and more there. I think maybe in this panel, as we are trying to see, okay, now how we, connect all these different national, regional aspects, how we make them interoperable and how we integrate all this is where we have not put so much on the table, but Lola was talking a lot about education, the education aspect towards the final user. So I'm quite confident that definitely this is embedded, but it's an excellent comment. I'm receiving this news that food is soon, I guess, with you. So the first thing I want to do is a big applause for the panelists. And then 30 seconds summary. Clearly, I think we have learned the hypothesis we started with, that really if we bring more data together and data from different sources, a lot of value can be created, but the challenges are still very, very a lot. I have to say that after many years working in this domain, I see more convergence, I see more synergies. I remember the colleague from Finland who talked about synergies, and I think we are moving in the right direction, but it's true that there are still a lot of challenges ahead of us. So I hope next year when we come to this summit, we have progressed a lot. Thank you very much and enjoy your lunch.
Thank you. Hello? I still have a little message for you, sorry. 1 minute. Not only to thank our panelists, saying that we'll have a session, a plenary regarding health and AI and citizens, so in the afternoon. Before lunch break, let me just briefly explain that during lunchtime, you have quite a bit to see and explore. We invite you to enjoy a dynamic networking environment featuring curated demos, including hands-on demonstration, hardware, software, and other health-related solutions. So enjoy the networking, take the opportunity to connect with colleagues and potential partners. We'll be back at 2:10. Lunch is upstairs. Thank you so much.